Have you ever scheduled a procedure and wondered whether Medicare will cover it? Coverage questions are some of the most common questions that our client service team gets from our policyholders at Boomer Benefits. And of course, we're always happy to answer them. Hi there, if we haven't met yet, I'm Danielle Roberts, co-founder here at Boomer Benefits and a member of the Forbes Finance Council. In this video, we'll go over how Medicare decides if a procedure is covered, and I'll give you some tips on how you can avoid a surprise bill for a claim that Medicare has denied. Stick with me through the end of the video because I'm going to tell you how to grab our quick Medicare Coverage Cheat-Sheet that will help you determine whether certain healthcare services are likely to be covered. When it comes to Medicare coverage of any procedure, the most important determining factor is medical necessity. Medicare defines this as healthcare services or supplies that are needed to diagnose, treat something like an injury or illness or condition and its symptoms, and that also meet accepted standards of medicine. Based on this definition alone, you may be able to answer your coverage question right off the bat. For instance, if you're asking, will Medicare cover a cosmetic procedure such as cool sculpting or fillers that reduce your frown lines, the answer is a pretty clear no. However, there are a few circumstances where your doctor can request a procedure to be covered even if it isn't thought of as medically necessary at first. For example, Botox injections normally aren't covered because they aren't medically necessary when being used for wrinkles. However, some doctors now also prescribe Botox injections to treat things like migraines. Your doctor could submit documentation stating that the injections are medically necessary to treat a specific condition. And if that procedure qualifies as medically necessary, then Medicare will nearly always cover it. While medical necessity is most important, there are other factors that may be relevant as well. One of these is that you need to get your healthcare services from a provider that accepts Medicare. Medicare has both participating and non-participating providers in its network. If you see a participating provider that accepts Medicare's assigned rates, then Medicare will cover the cost of the procedure and you shouldn't owe any excess charges. If you treat with a non-participating provider, then that provider can charge up to 15% more than what Medicare covers in most states. This means that you could end up with a balance bill that you'll need to pay. However, some Medigap plans cover excess charges for you. For example, Medicare Supplements Plan F and G will pay the excess charges, so if you enroll in either of those plans, you don't have to ask whether your doctor is participating or non-participating. It won't matter when your supplement already covers that for you. On the other hand, if you enroll in Plan N, which doesn't cover excess charges, you could owe them when you treat with non-participating providers that don't accept Medicare assignment rates. Although Plan N is usually cheaper than Plan G or F, here at Boomer Benefits we do sometimes find that clients who enroll in Plan N later contact us and prefer to move to Plan G because they find the balance bills annoying. I should also mention that there are a few states where excess charges are just not allowed. We have a blog post about this that I'll link to in the notes below this video, so that you can check to see if your state is one that allows excess charges. It's very common for people on Medicare to receive bills in the mail from their providers. Most beneficiaries aren't sure whether they owe these bills or not, and it can be especially stressful to receive a bunch of bills after a hospital stay. Now, this can happen for a number of reasons. One is that your provider bills you for the service before Medicare has had a chance to pay. This one is so common that here at Boomer Benefits, we tell all of our policyholders to call our client service team first before paying any bill that they receive in the mail. Our team researches these for our clients to make sure that they don't accidentally pay a bill that is in fact already going to be covered by Medicare or their Medigap plan. Another cause of unexpected bills is your doctor miscodes the procedure when billing Medicare. Unfortunately, this one happens a lot as well. Every service, procedure, prescription, and doctor visit have a medical code that corresponds with it. This code is how the doctor's office, Medicare, the billing department, and the insurance company communicate with each other. The code indicates what happened during the visit or healthcare service. A medical bill may have multiple codes detailing how the services and procedures should be charged, and if the wrong code is chosen for the type of visit, Medicare could deny the bill when in fact it should have been covered. Medicare would then return the bill to your doctor's office, and the doctor would bill you to pay in full, leaving you wondering what happened. For example, let's look at the Welcome to Medicare visit. This is a doctor visit that you can schedule within your first 12 months of being on Medicare. If coded correctly, this visit is 100% covered by Medicare Part B. However, if the medical coder doesn't use the right code for the visit, Medicare may not cover it correctly since the translation of the service provided was incorrect. This is another most common billing issue that our client service team deals with and resolves on a daily basis. We resolve extremely common billing hassles like these for our policyholders, and our service is completely free. There are also certain things that Medicare has limits on. For example, Medicare Part A only covers up to 150 consecutive days in the hospital. After that, the cost of your inpatient stay comes out of your own pocket unless you have coverage like a Medigap policy to provide you an additional 365 days. Or if you go into a skilled nursing facility after a hospital stay, Medicare only covers up to 100 days. After that, you're on your own because Medicare doesn't cover long-term care. Likewise, with physical therapy, Medicare covers up to a certain amount each year, and after that point, they could request a review with your provider to verify that continued therapy is really necessary. These ordinary limits could result in unexpected bills if you didn't know about them, so it's always a good idea to familiarize yourself with what original Medicare covers. As you can see, there are several aspects to getting a service or procedure properly covered. However, there are also a few things that you can do to make sure that you get the coverage that you deserve. First, don't be afraid to ask your provider if Medicare covers the procedure that you are about to undergo. Second, you can also use Medicare's new What's Covered app to see if Medicare covers your procedure in general. Third, if you don't have a Medigap plan that covers excess charges for you, be sure to ask every healthcare provider or facility up front whether they accept Medicare's assignment rates. This will help you to avoid the excess charges that we talked about earlier. Finally, you want to research any bill that comes in that you thought Medicare should have covered. Never pay it without checking. Now, if you bought your policy through Boomer Benefits, just make a quick phone call to our service team and we'll handle it from there for you at no charge. On the other hand, if you bought your policy directly from a big insurance carrier, you are unfortunately on your own, so you'll need to contact your provider's billing department to see if they coded the procedure correctly when they billed it to Medicare. And if they didn't, they'll need to resubmit the bill with correct coding. I should also mention that when you have an unpaid bill, you don't have to wait for Medicare's quarterly summary notice to arrive in your mailbox to try to figure out what happened. You can sign up for mymedicare.gov, and this will allow you to see your claims as soon as they are processed. All right, folks, that's a wrap on our video about whether Medicare will cover your procedure. To grab our ultra-handy Medicare Coverage Cheatsheet, visit the link that I've left for you in the notes below this video. And if you'd like to see more videos from Boomer Benefits, be sure to hit the subscribe button so that you will always be notified when we drop a new video here on YouTube. Thanks for watching, and we'll see you in the next video.